hear that, you know it's my turn to burn. Time for Ultimate Health on Joy 99.7 FM. With me, Norte by nature. It impacts on your health and your well-being. We'll definitely talk about it. Every Sunday, 2:05, we're alive. By His grace and providence. Bringing you all the top-notch professionals and practitioners. Tell a friend to tell a friend. Ultimate Health on Joy 99.7 FM. We're live on Facebook and YouTube. Let me do my praise for today. I love this song to bits. Sadly, this week I lost a good friend. And this is one of the many songs she'll just me. Hey, you didn't dedicate it to me. Hey, buddy, I know you can hear me from where you are. Forever in my heart and in our hearts. So Raina Benuaku of the Bank of Ghana. This is a song you really, really, really loved.
Joy 99.7 FM.
Your hand go walk, your name go open doors.
Joy 99.7 FM.
Amen, amen. Everything you put your hand go walk, your name go open doors. You self go be a boss. Amen, amen. Every hustler getting paid. Where the hustle go come to pay. Your own in no go take.
Joy 99.7 FM.
If I walk to your own, God self go do his own, and flesh go cover bone. Amen, amen. If you believe it, say amen. If you believe it, say amen. If you believe it, say amen, amen, amen. Everything you put your hand go up, your name go open doors. You self go be a boss. Amen, amen. Everything you put your hand go up, your name go open doors. You self go be a boss. Amen, amen. Sister, where one man sees until where they fight begin. One day you go born twins. Amen, amen. Then that way don't losing job.
Joy 99.7 FM.
One day you go be landlord. Amen, amen. Good news go locate you. Watch and see it no go take. If you believe it, say amen. No, amen, amen. Everything you put your hand go up.
Joy 99.7 FM.
Self go be a boss. Amen, amen, amen. Everything you put your hand go up. Your name go open doors. You self go be
Joy 99.7 FM.
amen. Long life go follow you. Strangers go favor you. Great men go honor you. Amen, amen.
Joy 99.7 FM.
Most definitely, amen. Timmy Daklo.
This life goes still make sense. So, amen.
Looking right up at you, good friend and buddy. Ultimate Health on Joy 99.7 FM. Yeah, good Lord knows best, huh? All right, today we try to unmask hemophilia.
You know it's another OPK class.
I understand it as a typically or mostly inherited blood disorder, but I've got in the studio Dr. Nana Ejewa Ewuku, specialist hematologist with the University of Ghana Medical Center here in Accra. So we want to understand the causes of hemophilia, the types, symptoms, and treatment. If you have any experiences, concerns, questions, share them with us on WhatsApp, which is 055 11 11 997. We're live on Facebook and YouTube, Unmasking Hemophilia. Doc, what do I call you? Doc, Ejewa Doc, Ejewa Nana. You're welcome.
Thank you.
Good to have you. I know we've just had or just observed, I think, was it last week?
So Monday.
Monday was World
Hemophilia Day.
Right, okay. And so we're helping in the cause. We're helping to, should I say, educate, inform, and transform our listeners. All right? I introduced it as typically or mostly inherited blood disorder, but you're here to guide us. What is hemophilia?
So hemophilia, like you said, is an inherited bleeding disorder.
Okay.
Individuals with hemophilia, their blood is not able to clot properly.
Okay.
So then very minor injuries will cause them to bleed profusely, prolonged, than someone who does not have hemophilia.
Okay. So your blood or the blood of a hemophiliac, correct me if my terms are wrong, has a challenge when it comes to clotting. Why does blood have to clot?
Okay. So blood physiologically or in naturally, if there is an injury, blood has to clot to stop the injury so that we do not lose blood, we do not bleed out and die.
Right.
And every body has certain elements or substance in their body that helps the blood to clot.
Okay.
We have something we call platelets.
Right.
And they are the initial people who will come and stop the blood. And then we have proteins called clotting factors that will come and reinforce what the platelet has done.
Okay.
So that there will be blood, the bleeding will stop, it will plug the hole where the injury has occurred.
Okay.
So that there will be no bleeding and then healing can occur.
Okay. So this is like an initial divinely downloaded plaster, right? That when you get a wound or an opening, a cut, a lesion, then the cells of the blood will form a clot to plug that.
To plug that.
And that also facilitates the process of healing.
Healing, yes.
Okay. In the hemophiliac, you're saying that there's a challenge with the clotting factors.
Yes.
The proteins or the what? Ingredients of the blood or constituents of the blood.
That helps with clotting.
That help with clotting.
There are about 13 of these clotting factors. And they work together to form this stable, firm clot.
Okay.
In hemophilia, there is factor 8 or factor 9.
Right.
There is actually a third type of hemophilia, but it's very rare. So most of the time we do not mention it.
Okay.
And that one is factor 11. So if you have reduced or absent levels of either one of these, then you are termed as a person living with hemophilia.
Okay, and then you're prone to profuse, excessive bleeding. Very often unstoppable.
Yes.
Bleeding.
Yes.
Right. Now, can you explain to my listeners? I mean, we can understand bleeding when you have a cut, but I understand that you can bleed internally as well if you're a hemophiliac, right? So what kind of wounds, what kind of situations are we talking about? Is it just when you get an external cut on the skin, or can there be internal bleeding?
Okay. So with hemophilia, let me just say that. So if your reduced or absent factor is 8, you are termed a person living with hemophilia A.
Right.
If it is factor 9, it's hemophilia B. If it's 11, it's hemophilia C.
Right.
For persons living with hemophilia, very minor injury, and sometimes we call it spontaneous because there are things that happen that your attention is not drawn to it.
Okay.
So before you know it, there's a bump or there's a swelling of a part of the body, and if you ask the person will not remember when they had that trauma.
Okay.
Naturally, if someone has adequate numbers of the clotting factors, the body will quickly mobilize these things and it will solve the problem.
Right.
But because in hemophilia they are deficient or absence of these clotting factors, then the body is not able to do that, and then it manifests.
Right.
So the commonest, or sometimes we say the hallmark of hemophilia, is swelling into joints.
Okay.
So they can have joint bleeding, they can have bleeding into the muscles, they can have bleeding after trauma, profuse bleeding after trauma, after surgery. They can bleed into their brain. So they can bleed into basically every part of the body.
Of course, because blood goes everywhere.
Everywhere.
All right, and Joy 99.7 FM goes everywhere. This is Ultimate Health on Joy 99.7 FM with me, Norte by Nature. I'm in the company of Dr. Nana Ejewa Ewuku. She's a senior specialist I almost said hemophiliac. Hematologist, I almost said senior specialist hemophiliac, right? But that's her area of specialty. She deals with blood and blood-related disorders. She's stationed currently, should I say recently, at the University of Ghana Medical Center. Used to be with us in Kolebu.
Yes,
right?
Very recently.
Okay, and you bled your way to UGMC. But I won't complain. All right, so we've understood what it is. My blood is supposed to clot to facilitate the process of healing, especially when there's injury and various other instances or scenarios. Its inability to do so is because I lack or I have a deficiency or some form of mutation when it comes to the clotting factors. You mentioned factor 8, right?
Yes.
If that's the problem, then we're talking about hemophilia A. If it is factor 9, we're talking about hemophilia B, and then 11 is C. So there are different types.
Yeah.
Okay. Now, what would cause this deficiency in clotting factors? We started by saying or suggesting that most of the time this is inherited. Can we explain that part and then talk about causes?
Okay. All right. So there's a gene that is located in
Joy 99.7 FM.
And these X chromosome, these genes will send signals or instructions to the different parts of the body to produce these clotting factors.
Okay.
So it will send to the endothelial cells in the liver to produce factor 8.
Okay.
It will send it to the liver cells to produce factor 9.
Okay.
So if there is a change in the structure or a mutation, like we scientists will say, in the gene, then it means that it's not able to send that correct instructions for the body to produce or the cells to produce adequate and functional clotting factor or the proteins that we need.
Right.
So it's usually due to a change in the DNA that makes up the gene.
Right.
So that will send the instructions, and there are various mutations or changes that can occur.
Okay.
So because the gene is found on the X chromosome, it means that in every individual, if you're a male, you have one X chromosome, one Y chromosome.
From each
if you're a female, yes.
Right. Yeah.
And for me, I have 2 X chromosomes.
Okay.
So if somebody carries that mutation on their X chromosome, then they will give it to their offspring.
Right. Okay.
So that is how you...
It is inherited.
It's inherited.
So a person can be born with hemophilia.
Yes.
All right. So that would be what? Congenital.
Yes.
Right.
It's congenital.
So you are born with it.
You are born with it.
Okay.
However, there are few instances where the change will occur spontaneously in a female.
Okay.
So that female may not necessarily have been born with it.
Okay.
But she will not exhibit any of the symptoms.
Okay.
Then she will give it to, if she has a son and gives that particular X chromosome to the son will experience.
So she will be a carrier.
Yes, she'll be a carrier.
Right. Now, I understand, because this is, of course, a sex-based...
an X-linked, yes.
X-linked trait.
Yes.
But I understand it's more common and more likely to happen in males.
In males.
Right.
Exactly. Like I mentioned earlier, males have one X chromosome and one Y chromosome.
Okay.
So if the mutated gene is, you are giving it from your mother, then you just have one of that. Right. So there's no buffer. There's nothing to compensate for what you've lost.
Okay.
unlike females where we have 2 of the X chromosomes. So even if I get one from my mother and I get the other X chromosome from my dad, that doesn't have the mutated gene.
Right.
Then the other one will counter it.
Right.
So then I will not exhibit the sign. So it's commoner because males have just one X chromosome. It's commoner in males, but a few females can have hemophilia if they get it from their father, one from their mother.
Okay.
They think I get
Great stuff. We're learning all this on Joy 99.7 FM on a Sunday afternoon. The program is Ultimate Health with me, Norte by Nature. We're speaking to Dr. Nana Ejewa Ewuku. She's a senior specialist hematologist with the University of Ghana Medical School. If you have any questions about this bleeding disorder, you can join us with your questions when I later activate the phone lines. We're live on Facebook and YouTube, and WhatsApp is 055 11 11 997. Okay, we've understood that part. So this is what causes it, right?
Yes.
I'm guessing that our listeners will be wondering, so shouldn't there be quite a few people? Can we look at prevalence, right? How many people? I read something somewhere, I don't know how dated it was, suggesting in a particular US sample 1 in 5,000. So, right? In Ghana, what does it look like, and globally, what's the picture?
So globally, we'll say that between 1 in 5 to 10,000 live births.
Okay.
Male live births. So every when you have 5,000 to 10,000 people to be born, one person will have hemophilia.
Right.
Yes. So in Ghana, with our population, we are looking around over 3,000 persons living with hemophilia.
Okay. Right.
But we do not have, our data is currently the Hemophilia Society has about over 400 registered, confirmed persons living with hemophilia. Just 400.
All right. As soon as you bring that in, Doc, then I'll start to look at, well, how do we diagnose it? I'm walking around. I'm fine. Life is going well. I'm good, right? Nobody mentioned this in my family. I haven't heard anything. How do we conclusively diagnose hemophilia? And then after we've sorted that out, we'll probably get to look at some signs and symptoms.
Okay. So hemophilia, there are different severity levels.
Okay.
Depending on how much of the protein that you're missing. So you can have severe disease, you can have moderate disease, and you can have mild disease.
Right.
So most of the time, since it's congenital, it is noticed early in childhood, especially for those with severe disease. Those with mild and moderate disease sometimes may be missed till they're a little bit older. So they will experience some symptoms that will prompt their parents or somebody to take the child to the hospital before we can diagnose it.
Okay. Right. Are we routinely checking for this? I look at the numbers 1 in 5 to 10,000. Is this something that we'll check and be as concerned perhaps as in the case of sickle cell?
No.
We're not checking routinely?
No. Routinely, we do not screen children for hemophilia in the general population. Unless you have a family history, then we will, a boy born into a family with a family history of hemophilia, then we'll go ahead and screen that child. But routinely for all children born in Ghana, no, we do not screen them routinely for hemophilia because it's not so common.
Right. Yeah. Okie dokie. I guess you may be listening to us attentively and wondering, well, so is it a big deal? What if I'm bleeding? I mean, won't they just stop it? What kind of severity she's talking about? Am I gushing, or is it just flowing and it will not stop, and so on and so forth? We'll look at the symptoms and then look at their manifestations. What kind of things will I see? I've read a couple of things about those who came to clinical notice because of problems or hemorrhages during pregnancy or circumcision. and so on and so forth. If you have any questions, concerns, 055 11 11 997. Shortly, we'll activate the phone lines. We're talking about this typically inherited bleeding disorder, hemophilia, and why you must know about it and be concerned, especially if there's a family history. Share with us on WhatsApp. Oye Nafienya, I see you. We're welcome in your home as usual. This one from Dede. Dede shares with me in my loss. Dede, we are mourning, but we're still doing our education. She says, can people with this condition be operated on? Dede in Maryland is asking that. We'll get there when it comes to intervention, management, and treatment. So you can share yours, 055 11 11 997, Ultimate Health on Joy FM. Right. So, how do these symptoms manifest? Okay, you say sometimes it's spontaneous and internal. You mentioned swelling of the joints. We know swelling of the joints can be related to other conditions.
Yeah.
So tell us a bit about signs and symptoms that we could be a telling or a conclusive flag.
Okay, so one of the commonest signs of presenting symptom is bleeding post-circumcision.
Right.
Because we've mentioned that it's common in males, and we know that a lot of males around the world are circumcised, and so they do not know. Their parents do not know. They've especially before when we had the Wanzams were doing the surgical cuts. So
they're still doing it.
Okay.
Yeah.
It's reduced. Maybe it's not as common as before.
You kidding me? From here, we are going to Newtown.
Okay.
I'll take you to about 5 or 6 Wanzams.
Okay.
And some of them have had enhanced training.
To be able to identify complications and then report appropriately.
Oh, I need to take you to Malata.
So you take a child is taking to the Wanzam to be circumcised, and post circumcision you expect some bleeding, but the parents go home and they notice that the dressing is soaked, the child is just bleeding profusely, prolonged, and it's just not stopping. Okay. And people have lost their children because of that. Right. Circumcision-related hemorrhage. Actually, if you look into the history of hemophilia, you realize that long ago, people realized that males born to certain families were dying from circumcision. Right. So then they were asked not to circumcise subsequent male children. Okay. So post-circumcision bleeding is one of the commonest, especially for those with severe disease. Okay. And then sometimes you notice that as the children become very active, more active, they start crawling. You notice that they have all these swelling bumps like hematomas on their and then bruising on their skin, which you can't tell because the child did not fall, the child did not hit anything. But then you see a bump today, tomorrow, after a couple of days, it sort of goes on its own. The next day, a week later, you see another bump somewhere. Sometimes as they start walking, you'll see that their knee joints become swelling and very painful. They cannot walk on it. They get a small cut and then they are bleeding. You expect that you apply a little pressure on it and the bleeding stops. And this one, it doesn't. Okay. Children have been sent to the emergency room for just hitting your head on the table and just getting a cut. They'll apply pressure, put a bandage on it, and they are fine. But for a child living with hemophilia, it will not stop, and they will have to go into the emergency room. Okay. So those are the things that will make a parent aware that no, something not
ordinary, not normal.
Normal is going on. It will prompt them to go into the hospital. Then the medical healthcare professionals can then do laboratory investigations to confirm whether they have hemophilia and then the type that they have. Okay, let me ask this. So you're suggesting that these bumps and swellings, right, are actually indicative of collection of blood under the skin or internally. Yes. Right? So you, the parent, will see this or see it manifest as a bump. Yes. Okay. In us, the dark-skinned, probably that's like a swelling or something. Yes, would there be a discoloration? Sometimes you will see, when you've bruised yourself, because the place becomes darker. A little bit. Okay. Then after a while, you see it becomes firm. Right. With time, it sort of goes down slowly. Okay. And even normally, children, as they become active, they are jumping, they are falling down. You expect that when they get a bruise, a little bump, it should go away after 2 days.
Okay.
But this one, it doesn't.
It doesn't.
And the swelling is bigger than the injury.
Right. So in this instance, the child or the person is losing blood internally.
So the child is losing blood into the muscle, is losing blood into the joints.
Okay.
They can, like I said, sometimes they are playing football, they fall down, they hit their head, and they can bleed into their brain.
Right.
So they are losing blood all over, anywhere that you can have blood.
Okay. So if a parent notices these kinds of presentations, they should have the child checked out.
Yes.
At a health facility.
Yes.
Okay. Right. And it may be indicative. You mentioned conclusive laboratory investigations. Are they going to now check the clotting factors and other things?
Yes.
Or they'll take your blood and see if it after a while it will clot, or what do they do?
Well, doing that is just basically doing what the child has been experiencing, because obviously it's not clotting well. But then there are clotting profiles that we do that will tell us that, so in there are screening ones that will tell us that this child may have hemophilia,
right? And
we don't know which type it has, because that particular lab will be the same for all the types of hemophilia. Then you go and assay the particulars to see how much factor 8 do we have in this boy. Then it will tell us that this person, so we do it, and then factor 8 is 2%. Then we know that this child has moderate hemophilia.
All right, 28 minutes past the hour of 2 on Joy 99.7 FM with me, Norte by Nature. We're talking about blood, yes, especially when it doesn't stop. We take a lot for granted, but can you imagine? It has its own built-in mechanisms. It's supposed to clot when there's injury or trauma, and if it doesn't do this, there is a serious issue, although rare. Right? Once identified, it's a serious issue. I'll be looking at the downstream complications. I mean, what if I have this and I'm not listening to Ultimate Health, I haven't had any problem with circumcision, and so on and so forth. Will I live a normal life? Right? What are the possibilities and the possible or potential complications? Did they ask earlier, can they be operated on? She's not talking about treatment. She's saying that surgery means cutting. Right? So can you operate on such persons, especially if you are not aware of their clotting deficiency, so to speak? So
sometimes they can, but you'll have to replace what they are missing. But before surgery is carried out on any person, these basic screening labs are done for everybody. So once you do your clotting profile and you realize that your APTT is prolonged, then the clinician will refer you to come and see us to investigate further to know that this person has whether the person has hemophilia or not, and then appropriate measures can be put in place before the surgery happens.
I got this from I can't get the name. Good afternoon, Norte. Accept our condolences. Thank you. Our prayers are with you. Yeah, and with the family as well. Right. So again, this is a concern. Should you be unaware clinically and proceed to operate or conduct a surgery on such a person, you may run into difficulties.
Yes, you may.
All right. So I think that's the thrust of the day's question. So we can conclusively diagnose, right? These are some of the symptoms. Okay. So if this is happening internally, for example, will I notice any? Will I have headaches? Will I have pain? What kind of things will the hemophiliac experience?
Okay. So it all depend on where the bleeding is occurring.
Okay.
Usually the commonest sites where they bleed is in their joints. So their joints will be swelling and it will be painful, and you'll have difficulty moving that joint. Sometimes it is interpreted for certain other disease, like individuals with sickle cell disease. They also have bone pain and they can have joint pain. So sometimes some family members will think, this child has rheumatism. So before you know it, they have joint deformities, because the bleeding comes, it stops, it recurs, and with time they can have joint deformities. So if it occurs in the joint becomes swollen, it becomes painful, you have difficulty moving that joint. If the bleeding occurs, if it's a mass muscle bleed,
Right.
especially after they've had intramuscular injections.
Right.
Then they have a hematoma, that's collection of the
Right.
blood in the muscle.
Okay.
So you'll see as a big, large...
Just following an injection.
Following an injection
Right.
into their...
Wow.
So even with children doing their vaccinations, once they get an IM, intramuscular
Right.
vaccine, they can have the hematoma forming.
Okay.
And then, because you'll be told that, you can get a little swelling, but this one you realize that
This
it's
one is
very
more than
big.
a little.
Exactly. It's
Right.
more than the usual. Then
Okay.
it can be the cause for concern. Sometimes they can even have a GI bleed. So
Right.
then they will pass dark stools. They
Right.
can bleed...
Gastrointestinal.
yes.
Right. Okay.
They can bleed genitourinary, so
Right.
they'll start urinating blood.
Okay.
There'll be blood in their urine.
Mm-hmm.
If it occurs in the brain, they can come in with a stroke. So
Wow.
it depends on where the bleeding occurs.
Okay.
That's just how the manifestation will be dependent on where the bleeding occurs.
Okay. You're with us 33 minutes past the hour of 2 on Joy 99.7 FM Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05 with me, Norte by Nature. We're dissecting, we are unmasking hemophilia. You may know or may have heard that the late Queen Elizabeth, right, and her husband Philip were direct descendants of Queen Victoria. All right, a very well-known, should I say, carrier or...
Yes.
She was a carrier. She was a
yes.
carrier, right, of hemophilia,
Yeah.
right? And this is well documented.
Yes. So
Okay.
sometimes hemophilia is known as the royal disease or the kin
Exactly.
disease. Yes.
Exactly. All right. Doesn't sound too royal to me. I'd rather do without it, but it's good to know we're living and learning on Joy 99.7 FM. Okay. So we have some understanding of the causes. We have some understanding of the numbers in Ghana. We have some understanding of the presentation, manifestation, or signs and symptoms, and again the different types. Okay, I understand A, which is a deficiency in the factor 8, is the most common.
Yeah.
Right? Are the symptoms the same across board?
So most of the time, A and B, the symptoms are the same. You cannot differentiate clinically between an A and B. You can only differentiate it after you've done the laboratory test.
Okay.
For C, most of the time, you see it after major trauma. They rarely have the spontaneous bleeding.
Okay.
So, but for A and B, it's very difficult to differentiate them clinically.
All right. Let me announce the phone line 0302-216-541. 0302-216-541. I'm in the studio with Dr. Nana Ejewa Ewuku. She's a specialist hematologist. With me in the studio, yes, we're getting ourselves bloodied in the sense that we're learning about hemophilia and normally or typically inherited blood disorder where your blood fails to clot. Right, and there are challenges to various degrees with the capacity of your blood to clot and form the clots that are protective to you, your system, and your health. We are going to be understanding shortly, well, what's the big deal? Okay, I get a bump here and then it goes away. But otherwise, I think I'm fine. What's the big deal? So coming back to you, Doc, I've activated the phone line 0302-216-541. What's the big deal? I mean, I understand blood goes everywhere. So this potentially can happen everywhere. Yeah. Serious, major organs, and so on and so forth. If it's undetected or unmanaged, untreated, what are the downstream possible or potential complications?
Okay. So one of the major things are joint deformities because you keep on bleeding into the joints,
right,
and the body's mechanism to, even if there's a bleeding to the joints, to be able to take out that blood is overwhelmed because the bleeding is recurrent.
Right.
So it's not able to do that. Eventually, you get arthropathies. If you bleed into your brain, you have a stroke, you can die.
Right.
If it's not detected and say you're going for surgery, we all know what can happen once you're on the operating table and your blood is not clotting.
Right.
Various injuries you get a cut somewhere, the person can bleed out and die. So most of the time is all these joint deformities. They're in a lot of pain, so they have reduced quality of life, and what we fear most is mortalities due to all these injuries, which can be avoided or prevented if there's proper treatment for it.
All right, so my phone lines are active. Let's start looking at what can be done about this. If it's inherited, it means it's in my DNA. It's on my pink sheet, okay? Unfortunately, I came from that police station called my family, right? So I inherited this. I'm in the male line, and it came out this way. Rarely, I'm also in the female line, and I got it. Most people like me asking this one first. Is it curable? We like the word treatment, but cure is more African. Cure, right? Is hemophilia curable? Before we move further down the line.
So there are actually potentials for cure.
Right.
And quite recently for hemophilia B, the US FDA has approved gene therapy for hemophilia B. Hemophilia A is still in the works. There are phase 3 trials for gene therapy for potential cure.
We, the Africans, when we hear cure, whether it is an Osofo, a bishop, an angel, we are interested. So there's a cure.
Potential cure
for B.
B, it's actually been approved.
It's been approved. So you mentioned gene replacement.
Gene therapy. So it's like the gene that there's a defective gene. Right. So the corrected gene through an adenovirus is infused into your system, so that the liver will now now you have a new gene, and
the liver will start copying it.
Yes, to produce enough of the factor 9.
Right.
For hemophilia A, currently the gene therapy has not been approved, but they are working on in trials to work.
It's in the pipeline or the veins. Okay, it's there. So potentially we can say in some instances or scenarios it is curable.
Potential. But for now we are mainly doing with treatment. Yes.
Okie dokie. This one says, let me see, where's my... Right. This one says, I really enjoyed hemophilia education. We're not done yet. I salute the facilitator. Good afternoon to Mr. Serene Akpanya in the northern region, Abochi Philip from Keta. Okay, Abochi, we're not done yet. Don't leave class. So I'm alive, no? All right, this one, Ajiman Joseph in Tema says, hi, Naughty, please ask for me. Is it true that if there is not enough starch in your body, your blood flows abnormally when you get a little cut? Starch and bleeding. From Professor Ajingo in...
No, it's got nothing to do with starch in your body.
Ajingo, Sheyu, right? When you buy, this is the place to ask anyway. All right, It has nothing whatsoever.
No.
Okay, and he's in Community 9, but we're talking about Factor 9 and Factor 8. But this is Community 9. Tema Ajingo, this one, we're glad you asked though, but it has no relationship according to my specialist in the studio. All right, so there's some potential or registered treatments which can achieve what we can call cure. Which means that the person comes back to normal or normative clotting.
So the person, produces enough of the missing clotting factor to normalize that.
Okay.
Yes.
All right. Okay. That doesn't mean you don't bleed, though. Please, those of us with the normal clotting factors, we still bleed. Right? We're just looking at the capacity of your blood to clot in this instance and this abnormality, right? Phone line 030-221-6541. Let me hear your voices, okay? I can see you all typing seriously. Very soon we'll say stop where 20 minutes to time. All right, so treatment. What does treatment mean? So it means I'll have these incidents where there's uncontrolled or difficult to control bleeding.
Yes.
And there's treatment for that. What does that constitute, or what constitutes treatment?
Okay. So before I get to treatment, let me just mention that for management of hemophilia, there are different disciplines that are involved.
Okay.
I mean, you can all guess by the because it can affect various parts of the body. So we have the hematologists, we have the orthopedic surgeons, we have the physiotherapists, we have social work and psychological health. Very, very important in persons living with hemophilia and nursing work.
Okay.
For treatments, basically you are replacing what the person doesn't have.
Okay.
That is the treatment.
All right.
You want to give the person back what they don't have, so that then their body will function like somebody who does not have hemophilia.
Right.
And in treatments, ideally, you are supposed to prevent the person from bleeding.
Okay.
So you give what they don't have. You give it at regular intervals so that they do not bleed at all.
So you're not waiting for an incident.
Yes, that's
This
the
is
ideal
preventive.
situation.
Okay,
Yes.
so you are boosting the body's capacity or the blood's capacity
Exactly.
on a prolonged basis.
Yes,
right?
so that they
Okay.
don't bleed at all. That is
Okay.
the ideal situation.
All right.
That's what we want to happen.
Okay.
And it actually happens in North America, in the Europe, in the Western world. That's what they do.
You won't even come to North Carnation, North America. So do we do that here? Is it
Unfortunately,
available?
we have the clotting factor,
Okay.
but we cannot do that type of treatment.
Okay.
Unfortunately, because we don't have enough.
All right. So what's the outlook when it comes to treatment for a patient or a hemophiliac in Ghana?
In Ghana, unfortunately, we wait for you to bleed and then we'll stop the bleeding.
Oh.
We cannot give you continuous
Joy.
factor to prevent the bleeding.
The challenge being,
We do not have enough of the factor.
but the factor exists in other parts of the world.
Yes, they
This
have.
is not about Ghanaian factor or whatever. It's a factor.
No. It's yes, or the medicine. Let's
The
say
medicine.
let's say the medicine.
So what I'm trying to extract from you,
the medicine
with,
is available.
with difficulty is it a financial
Yes.
constraint? We
Yes.
can't afford it.
We can't afford it,
Uh-huh.
or yes, we can't afford that.
That kind of treatment, even if we
Yes.
had access to it, we can't sustain it over time. Oh,
Yes, because it's very expensive.
okay.
Per year, per patient, if you are doing preventive, we are looking over $100,000 per year per patient.
Whoa.
There are other types. We also have what we call, they are mimetics. So they are also a different kind of medicine. It behaves like the factor 8.
Okay.
That one for treatment per year per person is over $500,000.
I'm just checking you out. I've been looking at the colors in your lovely dress, and they so match Joy FM studios. Yeah.
Okay.
But if so, the $500,000
Per patient
it goes
per
to-
year.
goes to you.
No, it goes to the pharmaceutical company that produces the medication.
it.
Yes.
So what I'm joking with it, but seriously, what we're discovering is that we lack that capacity,
Yes.
and we cannot provide that
That
here.
approach
Okay.
here.
I won't even go as far as wondering whether it is covered by any insurance policy or anything like
No.
that, because they do with risk, right?
Yes.
And therefore, even this small risk or prevalence, right? I doubt if any insurance company will go into covering this. Or
So no. So currently the medicine in Ghana, it's through donation.
okay,
So it's not as if you can go to the pharmacy and go and buy it
Right.
currently.
Okay.
It's through the donation of the World Federation of Hemophilia
right.
and other stakeholders through the work of the Ghana Hemophilia Society and
Okay.
other healthcare professionals.
All right.
So we get it through donation. We are not, the government is not
Not
bringing
buying,
down,
yeah.
buying the medication for
All right.
use.
Okay.
Yes.
Right. So that would typically trickle in.
Yes.
If we have some and you're lucky, we'll give you for a while.
So, well, currently we have, but like I said, when they are bleeding, when they notice a bleed, then they come in and we give them to stop it.
Before I give you a breather and read a couple of messages, let me ask. So when you're on this preventive treatment where
Yes.
we are boosting your blood's capacity to clot using these let me call it pharmacological products,
Yes.
right? We haven't cured you.
No, we haven't cured you.
We are managing the condition.
Yes.
Right? So it's not
Yes.
as if after some time under that treatment, your 500,000 a year is going to stop.
No, it's not.
You've
going
got to
stop.
be on it.
You've got to be on it.
Okay, that's the realization and the reality I wanted to capture.
Yeah.
All right.
Joy.
055 11 11 997, my WhatsApp. Good afternoon. How are you? I am fine. Thank you for your educative information you're giving to us every Sunday. But please, is there a platform which you put the topic that you guests normally come and teach? then add me, because just sometimes I do miss this vital information. Okay, Hayford in Bato. Okay, Abek will work on that. Why we normally put a flyer out, but if you want a platform or a group, I don't think we've done that for Ultimate Health for various reasons, but we can consider that. Hemophilia is genetic. That's from Dede in Maryland. I understand diabetic clotting takes a longer time. She's hearing this from a friend. That's very careful. You have to be careful about cuts, etc. So hemophilia and diabetic clotting are not one and the same, but it is interrelated in medical terms. Then she puts a question mark. So can you comment on that? Part of it sounds like she's telling us and sharing information she's heard, and then it ends in a question mark. What's the relationship between hemophilia and diabetes?
In terms of bleeding, no.
No relationship?
No.
Oh, okay. Right.
In terms of bleeding, no. So
she's suggesting there that a person who is diabetic will typically have some challenges with blood clotting. Are you aware of that?
So usually individuals who have diabetes, they actually have atherosclerosis,
okay,
and not necessarily blood clotting.
Okay.
Yes.
All right. Okay. So she's asking, therefore, the answer to the second part, they are not one and the same.
No, they are not one and the same. But someone with hemophilia can have diabetes.
Right.
Yes.
Okie dokie. So are they interrelated in medical terms?
No.
Okay. All right. Then they will continue when I've gotten some beer or something to drink, and we'll look at this, and then I can join Ajewa to the discussion, right? So that you can deal with her for me. Fibromyalgia, does it have anything to do with clotting factors? Eric in Ho. Right? That's quite a painful condition as well.
Yeah.
Yeah? Is it related?
Some of them, there are genetic basis for that.
Right.
It doesn't necessarily mean that, for all these, like I said, somebody with hemophilia can have diabetes.
Right.
Because they are predisposing, for all of us, sedentary lifestyle, and it's a lot of persons living with hemophilia have sedentary lifestyle,
right.
And as they grow older, especially in the Western world, where their life expectancy is close to normal, to persons without hemophilia, then we are worried about their cardiovascular health. They getting diabetes because of the sedentary lifestyle, because they are afraid that if they are involved in rigorous activities, they are going to bleed.
Right.
So a lot of them are prevented from, and so those risk factors that carry up with the general population, they also have it. It doesn't exclude you, but it doesn't necessarily mean that if you have diabetes or if you have you by all means get diabetes.
Okay, I guess the intersection, maybe the listeners and the last contributor are relating to, is the fact that with fibromyalgia you will get muscle tenderness and pain, and you can get that with the swellings and the hematomas. But joint related, or
no? So that's why I'm saying that sometimes the symptoms may mimic other diseases, because once you have the pain, the joint swelling, it could be. You could have sometimes even people with rheumatoid arthritis. Somebody living with hemophilia, especially if the person has mild hemophilia, may mistaken for somebody who has rheumatoid arthritis. Yes, because of the way they present. It doesn't necessarily mean that they are related. It's just the way they present.
Okay, great stuff. 0302216541. You can call us if you so desire to ask your question directly. WhatsApp is 055111197. Hello, greetings, Ultimate Health team. Greetings. Please, if a lady is a hemophiliac, will she bleed more during her menses? Thank you.
Yeah. Yes, so it's been noticed that carriers, generally, because for carriers, they may have a slightly lower levels of the clotting factor.
Okay.
But their level is enough to prevent all these spontaneous bleed and these major bleeds. But they can have, so they may also experience a little bit more prolonged bleeding, especially on trauma when it's provoked.
Okay.
So they may have menorrhagia, like bleeding excessively during their menses.
Okay. Dede is back and busy in Maryland. Hemophilia and anemia. Is that possible? Can you bleed to the point where you are anemic?
Oh, yeah. Some people, you bleed, they can bleed. And I mean, if somebody can bleed, stress. So they can bleed such that we have to give them
Blood.
Yes.
Right. Okie dokie. If you've got your questions, WhatsApp is 055 11 11 997. On the heels of World Hemophilia Day, we are unmasking hemophilia. We talked about the causes, inherited or congenital, and then acquired. We talked about the types A, B, C, symptoms, and we are looking at treatment and management, and also answering your questions. Got about 8 minutes, so you can still stick in your question so that my guest, Dr. Nana Ejewa Ewuku, will answer directly. Stick and stay.
Joy 99.7 FM.
Okay, so we've talked about menstruation. We talked about whether they can have surgery. This would be a concern during pregnancy, would it not? Oh?
So usually, because women are usually not affected, during pregnancy, the carriers live normal.
Right. You're
life.
a carrier, which means that you can pass it on
to your child.
But
you don't necessarily have the disease.
The condition, right.
Even though sometimes you may have a little bit more prolonged bleeding, especially on trauma. It's provoked. They usually do not experience spontaneous bleeding.
Okay.
So they are fine. They give birth. They may experience a little bleeding, more bleeding postpartum.
Okay.
So then it may be a concern for the obstetrician, who notices that maybe this woman bled a little bit more than we're expecting. So we can then investigate and see. Even though for carriers, to be able to tell if someone is a carrier, then you have to do genetic studies to identify the mutation. Then you know that this person is a carrier.
Okay.
Yes.
All right. We've emphasized that it's largely inherited.
Yes.
Okay. This genetic deficiency. But can we speak or talk in terms of possible risk factors? Are there any modifiable or lifestyle factors that I should be aware of and I should avoid in order not to get acquired hemophilia? Is there anything I should avoid?
Okay. So acquired hemophilia is usually associated with various diseases.
Okay.
So that is,
it's not something you can actively encouraged.
So for congenital hemophilia, there is nothing that you can do. It's in your gene.
Right.
Yeah, you either have it or you don't.
Or you don't.
Yes.
Okay.
So there's nothing that you maybe you eat something that will make it go away, or no. It's part of your print, your blueprint.
Right.
So.
Okay. So it's on your pink sheet, on your Ghana card. It's a biometric trait. You can't do anything about it. Nosebleeds with no known cause or without a known cause. Can it be one of the symptoms? This is from Bright in Kofridia.
Yes, you can have nosebleeds. You can have gum bleeding. Sometimes when children lose their tooth, they may bleed a lot.
Right.
Someone may go for a tooth extraction, a dental procedure, and then they start bleeding a lot. So so uncontrollable nosebleeds, gum bleeding, bleeding post tooth extraction. So we get referrals from all various disciplines to for us to investigate.
Okay. My naughty mind is remembering something that came up in the media a couple of years back called a violent kiss. All right, I will restrain myself. I will not relate it to bleeding. But one show you.
Joy 99.7
Ultimate Health on Joy 99.7 FM. We're talking about hemophilia. My son I think my son OJ or something is having one leg bigger than the other. And when I inquired, they said hemangioma. So what is the difference between the two? Hemangioma. Right?
So hemangioma has got to do with blood vessels and the way they are, and sometimes you can have tumors of the blood vessels.
Okay.
It's not the proteins in the blood.
Right.
Yes. So they are different.
It's different.
Yes.
Okay. I'm glad that it's been identified, and I hope it's being addressed clinically or medically. And we wish you the best. Thanks for sharing that. Remember always to add your names to your messages. Is there anything else you want to leave us with?
Okay. So I know that the treatment is not what is ideal.
Indeed, I saw the theme is access.
Access for
all.
Yes.
So access to what?
Access to the factor concentrate. Access to treatment.
To treatment. Okay.
Access
That's
to
the
treatment.
theme.
Yes.
Yeah.
For access to treatment for everybody. And like I said, treatment is not where we want to be.
Okay.
But there is treatment
All right.
for persons living with hemophilia in Ghana.
Okay.
We do not currently able to boost your level at a constant level so that you do not bleed. But we are able to teach the parents, the patients, so that once they notice any sign or symptom of bleeding, they come in, we assess them, and then we give them the medicine or the factor that is missing so that the bleeding will not stop.
Okay.
So that the bleeding will stop. The bleeding will stop.
Right.
So treatment is available.
All right. You give them the treatment so that the bleeding will stop.
Will stop.
Is
Yes.
that free?
Oh yes, because it is donation.
All right.
It is free.
Okay.
You may just have to pay the hospital charges, but the treatment, the medicine itself is
It's
free. So all this $100,000 per year or the $500,000 per year is free.
Okay.
In Ghana, it is free.
Across
you do
facilities, or do I have to come in?
So we have treatment centers, unfortunately.
All right.
Our major treatment centers are Kolebu Teaching Hospital, Konfanochi Teaching Hospital. We are going to add UGMC very soon.
All right.
And then we have satellite treatment centers, about 10 spread across the country, where through the Ghana Hemophilia Society, the factor concentrate or the medicine is made available, and then you can get treatment.
Okay. Unfortunately, we couldn't get the founder, and is he a president?
Yes, of the society.
Is it Mr. Martin Boachi?
Boachi, he's caught up somewhere.
Right. He lost his son.
Yes.
To hemophilia.
To hemophilia.
Right. And he set up. Is there any contact number that we can give out for the association, or we can put that out on our pages later?
Yes, we'll do that.
So when or if somebody listening to us feels or matches the template or the signs, symptoms we talked about, when they go to a health facility, where do they go?
So when you go to the health facility, you'll see your primary healthcare physician.
Okay.
And then you'll describe your symptoms and your signs. The doctor will write for you the initial test or the screening test, which is the clotting profile, for you to do. Once it becomes prolonged, the person will then refer you to the hematologist, and then we'll do there. Right. Sometimes they may even write for you for the factor assay to be done in the laboratory. Right. Once it is done and it's confirmed, you are referred to the hematologist. Okay, right. Wrapping up, is this something I can go to a lab, or I should go to a lab and say, hey, please, they say something factor assay, do for me, so that I check on my own before I come looking for you guys? Is it something that people should do? No, I think you should, because there are other causes of bleeding. Okay. So if you go and do it and it's normal, you say your factor assay is normal, then you think you're okay. Right. Meanwhile,